It's not something most men are willing to talk about, but the condition can cause a lot of stress and embarrassment. Suling Go joins us now with more. And Suling, this is a really personal problem.
It is. It's called gynecomastia, enlarged male breast tissue. For some men, losing weight will correct the problem, but for others, it's more persistent. And one local plastic surgeon says more men are asking for help.
So what do we have scheduled for next week, Michelle?
As a plastic surgeon, most of Dr. Feng Chong's business is breasts, but not always female.
Hello, Troy.
Lately, more men are coming in for correction of gynecomastia, enlarged male breast tissue.
In the last couple years, we have definitely seen an increase in the number of guys looking for this type of procedure.
Gynecomastia affects up to 70% of boys during puberty. They usually grow out of it, but if there's an imbalance of male and female hormones, the condition can persist.
In some cases, there can be an underlying cause for this imbalance. So, for example, the use of certain medications, the use of certain street drugs, and sometimes certain illnesses can also lead to gynecomastia.
In 38-year-old Troy Harushka's case, it's just genetics.
I've had the issue since I was about 8 or 10 years old, and I was told that it would go away when you got older, turned an adult, and well, 30 years later, it's pretty much stayed the same.
Last week, Dr. Chong reduced Troy's breasts using a combination of liposuction and surgery.
The first 2 days, it felt like I basically went to the gym and did a good chest workout and it was sore. And by day 4 or 5, pretty much back to normal.
Dr. Chong does about 7 breast surgeries a week. Usually 2 of those are men. With Hollywood showcasing the male physique more than ever, he says there's less stigma associated with male cosmetic procedures.
There's a real pressure for everyone, not just females, but males to look really good. You know, everyone wants to go to the gym. Everyone wants to look good for the beach.
Troy used to avoid taking off his shirt. Now this restaurant owner and contractor says he can't wait.
I think first thing that I'll do is probably take a trip to Mexico or something, and I won't have the same issues anymore.
Good for him. Alberta Health does cover part of the cost of that procedure. Troy ended up paying $5,000 for his. Patients must be in good physical shape and at least 20 years old. And I did do a bit of research on this project. You can also get compression garments if you don't want to have the surgery. And it's like a t-shirt and it just kind of, you know,
Another option.
in. So it's another option, but good for Troy for sharing that story.
Very courageous for him to open up about that.